Hi, I'm Janie Dalrymple. I'm the nurse educator with the ALS Association Arizona chapter, and I have here with me Amanda Canizales. She's a nurse practitioner and a volunteer with our chapter, and we're going to show you today some range of motion exercises that all of our ALS patients should be doing. Amanda's going to be my patient today. So typically ALS patients will get orders from their neurologist for range of motion exercises that a physical therapist will do with you in the home. However, those are usually limited and aren't continued throughout the patient's whole disease. So lots of times it's relied upon the family to provide these range of motion exercises. So we're going to go through showing you what these look like so that you can perform them on your person that has ALS. Ideally, you want these exercises to be done once a day, and you want to do each exercise at least 10 times or hold to the point of resistance for at least 30 seconds. And then you're going to begin the exercise slowly, doing each exercise only a few times and gradually build up. And try to achieve a full range of motion, moving until you feel a slight stretch, but please don't try to force a movement. Move only to the point of resistance. And then you want to keep the limbs supported throughout the movement. So if your person is not able to support that limb, you want to make sure that you're doing that for them. And then obviously move slowly and watch your person. If your person is not able to communicate with you, you need to watch for any kind of grimacing or if they are in pain. If they're able to communicate with you, you need to ask them if they're tolerating the procedure. So the first one is hip and knee flexion. So basically what you're going to do is grab their leg and you're going to hold under their heel, and you're basically just bending their knee up towards their chest to a point of resistance and bringing it back down again. So up and down. 10 times on each leg. If you can do that. You don't have to do all 10 in a row at the same time, but you do want to perform that range of motion to the point of resistance and then back down both legs. The next one is a hip rotation. So you're going to have the leg in a bent position, and you're still going to have the leg supported in your arms. And you're going to bend the knee halfway to the chest like we have here, and then you're going to pull the foot towards you and away from you. And Amanda, are you tolerating it?
Yes, I am.
Okay, so she's doing all right. So 10 times this way as well. The next one is hip abduction. So her leg will be straight. You're going to raise it off the bed or wherever she is, and you're just going to rotate the leg out straight and back in. Out and back in. Okay. The next one is lumbar rotation. So sometimes this is not able to be performed by all ALS patients. But if you do have the ability to still be able to bend their legs, you're going to have them bend. And if they can't keep them up very well, you might have to keep your arm there for some support. But you're basically just going to rotate hips one way and then the other way. So you're doing that lumbar rotation. So one way and then the other way, rotating the hips. Okay. Okay, now we're going to move down to her feet. First one is ankle rotation. So you're just going to support the leg. I have her leg supported with my hand, and we're just going to rotate her ankle. So in, I'm holding her toes, in and out, in and out, in and out. Next thing you're going to do, obviously this is on both legs. Next thing you're going to do is toe flexion and extension. So you're going to pull the toes up, bend them down. Toes up, bend them down. Okay? Next thing is a heel cord stretching. So you're going to cradle their arm or their foot in your arm, and you can either do it this way or you can hold it in the palm of your hand, and you're going to push with a little bit of force with your arm against their toes and their foot so that you are extending their foot back. Like that. Okay. And then the last one on the legs, I think, is a hamstring stretch. So you're going to bring the leg up if you can. It helps if you can put their heel on your shoulder, and you're just going to push to the point of resistance, trying to keep their leg as straight as you can. If the knee starts to bend, then you want to back off a little bit because they're getting stretched too much. But you're going to go to the point of resistance, or when they say, whoa, too much. So up, and then you can back off a little bit, give them a break, and then back up. Both legs. Okay, now we're going to move to arms here. First one is elbow flexion and extension. So you're going to grab their arms and you're simply going to move. I have her elbow cupped in my hand, and I'm going to move her hand to her shoulder and back again. Just back and forth like that. Once we've done elbow flexion, we can do shoulder flexion, and that's simply raising her whole arm above her head if possible. Back and forth. I'll do one more time. And then you're going to do shoulder internal and external rotation. So you're going to have the arm at a 90-degree angle, and you're simply going to move the arm down and up, down and up, down and up. If the patient is able, you can do a shoulder abduction, which is basically their arms or their hands behind their head. If not, then you're going to put both arms up there and get that, that wing type feeling with their arms. But they can do that, and they can hold this as tolerated for as long as they want, actually. The next one is a stretch for their arm and shoulder, but it's across their chest. So you're just going to take the arm and rotate that hand to the opposite shoulder. So just a gentle stretch across, and you can even give a little push if you want to. If they don't feel like it's doing anything, give them a little resistance so that they feel that. So 10 times that way. Then, if they're able to, which Amanda is, I'm going to ask her to rotate her head so that her head is trying to touch each shoulder. So ear to shoulder, ear to shoulder. So that is some flexion, and then she can do a yes and no and a side to side. So we're getting all kinds of rotation of her neck. And then the last thing that you have are hands. We want to do wrist flexion, so you can hold the arm, you can hold it by the elbow, you can hold it by the forearm, whichever you want to do. And we're going to rotate the wrist down and up. And then we also want to do fingers. So we're going to open them up and close them. Open and close. And then we don't want to forget the thumb. So we want to make sure that we're rotating in and back out. And in and back out. So these are all range of motion exercises that should be performed on your person every day. If you do not have a physical therapist, you should really think about doing this once a day, at least. Sometimes it's encouraged to do it even twice a day to help keep those joints moving so that they don't get contractures. That's where the pain comes from. So we want to keep them as mobile as possible. Thanks.